Hi, I'm Dr. Charlie Schuster with Back to Health. I'm back to talk to you about hip mobility, knee mobility, iliotibial band syndrome for people who have those problems along with this muscle on the outside of the leg, low back mobility. All of these have this in common, in that we need to loosen the fascia, which is the covering of the muscle, but also individual fibers of the muscle are covered with this encasement called fascia that actually gets tightened down and doesn't allow those muscles to move like they should. So if you have not seen videos on foam rolling, there's a lot of them on the net, but we're going to demonstrate some foam rolling. And the number one rule with foam rolling is there really are no rules. It shouldn't be painful, but it probably will be very uncomfortable. The first time most of us pronate, meaning we let our feet rock in, and we have this reflex to protect the knees, so these muscles become overworked and very tight. And a lot of times we're not really aware of that until we get down on a foam roller. And when you go to sit on a foam roller, just get on it first, become familiar with it. Sit like this, and then we're going to want you to straighten your leg out like this. And we're going to put a lot of weight through these muscles as we roll over them. So to ease that and have some control over that weight and make it as comfortable as it can be, but it's not going to be very comfortable, you go down on your elbow just like this and put your foot, a lot of people do this, you can do this, again, no rules, but a lot of times people are more stable to put their foot in front. And you'll find when you do this, you're actually doing a little bit of core work. This is great for folks with scoliosis or curvature to do this on both sides. Side planks, a wonderful exercise for that. And I'm rolling underneath, and I'm just going just under the bone itself, and I'm trying to find the most stiff, sore area. And for me, it's actually going to be, I'm going to bring my leg back, and it's more in the back side of the hip for me. And just as soon as I say that, it might be over in the front for you. We're going to make it around to the front, but we're going to stick right here for about 20 repetitions because I found an area that's very sore tight on the bottom of that hip, on the side, but a little more to the back. And then I'm going to scoot up a little more of a side plank here. And you'll notice I'm keeping my body off of the ground just a little bit so that I can roll across the foam roller. And as I work these muscles on the outside of the hip, I'm prepping them for a great stretch. And so I'm going to go down lower even, not quite to the knee, but right above, and get right in there. And then I'll probably just pull this over a little bit to get a little more on the front of the hip. Right above the hip to the front, right, with my hips right here, I'm going to go right above. Very difficult area to get into, but also a very important area to keep mobile. And I'm just going to go back and forth above there because that's always an area that is needing to be cleaned out. We talk about cobwebs in the corners of the room, and this is one corner of the room that will always collect lactic acid, aka cobwebs. And so I want to clean those out and loosen that. Now, the other part of the iliotibial band is so important. It goes up into the buttock area, so you can kind of kill two birds with one stone. And you can come in like this, sit here, and work the deep muscles of the butt to get those guys nice and loose and untangled. This is a great thing to do before we even begin to work on the software. This is not an exercise, it's actually self-treatment. You're going in and loosening up fascia, and it's like giving yourself a deep tissue massage almost. When it comes to myofascial release, this is one of the best ways to loosen up fascia. It's not the most effective way to treat a trigger point by any means, but it does help loosen tissue. And so what I'm doing now is I took this position in the buttock. I didn't notice a lot there. A lot of people will. But if I go to the side, go down again, and go like this, I can get right into that sore area above the hip and on the side that's so hard to get to. I found that to be very helpful. You can also go down like this and take care of the muscles along the side of the low back. These shouldn't cause undue pain, but they're not going to be comfortable necessarily. And I can feel an almost tearing. It's not tearing, but I would describe it like that in the tissue in my lower back as I do this, because it's also stretching it. And then I will do this on the other side as well. So you always want to do things on both sides. I'm going to just start where I left off on the other side and then work my way back, working these muscles. Now as I do this, I'm noticing that I'm a little more tender on the left buttock and hip area than I was on the right. So I want to even those out. I'm going to come in over that area about 20 times. Great. Getting a good work there on that and loosening it, prepping it again for some good stretching. And then I'm going to go over to the side like this, and we're going to work the muscles right above the hip. It's a little trickier, kind of an advanced move with rolling, but again, if you can get that isolated, however that would be, that you can figure out how to isolate that muscle. I'm actually getting it really nicely right now by just relaxing that leg, and I'm going to go over that 20 times. It deserves some attention right there. So as I'm doing this, I'm also gently mobilizing passively. Just, in other words, I'm not activating it myself, but just moving the hip and just oscillating it a little bit, getting some movement in there, some up and down type movement in it. And this is just wonderful for the hip. It's good for the joint. It helps bring fluid in and out, and to feed those surfaces that we call articular surfaces in the joint. I'm going to come over again, get on my side, work the upper leg, ITB, iliotibial band, and this is again just a muscle along with the glutes and the muscle right above the hip, the G minimus. These guys develop lactic acid accumulations. Really not too many other muscles in the body that do it more. Maybe the trapezius and gastroc, but calf and shoulder. But if you see what I'm doing there, I found a nice tender spot. I'm going over it about 20 times. On this leg, I'm finding more on the front of the thigh, so I'm going to hang out there a little bit more, right along the front. That is actually very uncomfortable, but I know how much better I'm going to feel when I'm done. So I'm going to find my happy place, and done. Now, this takes us to a nice little stretch session, and I like to start my stretches by lengthening the hip flexor, because it's the one when we sit that becomes shortened. And if I can get it to lengthen, then I'm going to have more relaxed hamstrings for stretching. Excuse me. And so come in here like this. If you can stretch the psoas muscle, great. Excuse me. We're going to go ahead and stretch both sides. If you ever do this stretch, most people will try to go out like this and then arch their back. And the reality of it is you're just rotating your trunk, holding it locked and still on your pelvis. And then you can raise your arms up to get a little bit more of a stretch. And you'll feel that through here, typically, maybe up in here a little bit. Very important muscle to stretch, the hip flexor. It attaches to the lower four lumbar vertebrae, and if it's tight, especially on one side more than the other, it's not going to allow those joints to move correctly, and then you're going to have all kinds of problems. And so I like to start with that one. This is best done with shoes on, so you can bend your toes under, lean back like this. Now I'm feeling it right through here. I already know that this left side thigh is a little tighter than the right, so I'm going to really work to stretch it in a way that would be more equal. And I can rotate my trunk a little bit. I can even take that leg and a knee pointed out and get a whole different group of muscles right there. And that's almost painful, but it's a good hurt. Hold it for 20 seconds. And then I'm going to go ahead and check the other side. Drop that left shoulder down, kind of twist just a little bit to get a little bit more torque, and stretch in this front thigh. I may even go like this, just to see. I don't get a lot more stretch when I do that. If I put my leg out and rotate, I don't get a lot more there, but it's a different stretch, so I'll hold it for about 20 seconds. Really important to lengthen these muscles. And then I'm going to go ahead and stretch these guys and these guys right here. And best stretch for that, if you have trouble holding your knee up, you can get against the wall like this and come in, but you put your opposite hand under and put a lid on it and just lean back. Pretzel stretch is what a lot of people will call this. It's a wonderful stretch for your low back, your buttocks, your hips, your knees. Phenomenal. I'll hold that 20 seconds. Then I'll do it on the other side and hold 20 seconds. Good. And once these are nice and stretched, then you can go into hip mobility. We have a segment I urge you to go look at, Secrets of the Hip and Knee, and we show you how to really get good mobility in the hip. We've got some great hip mobility exercises that this leads right into, and we'll leave it at that for this segment. Thank you.